Yes, empathy is I'm taking half an hour, am I?
Yes, sir.
Half an hour, isn't it? Yeah.
Yeah.
Okay. Empathy is a important topic for many reasons. And you will realize that empathy is the most important thing in many aspects. And in fact, we are planning to do a workshop for school teachers, school principals, where we are trying to teach 10 empathy competencies using 5 methods of learning and teaching. You'll understand that later. So empathy has a lot of things to do with health promotion. Empathy can prevent communicable disease, non-communicable disease, and antisocial behaviors. You will understand it soon. And empathy is important in the process of education. You learn, you truly learn, you try to change your behavior, you become a different person because of empathy. Empathy is important for your family life, as well as empathy is important for your social life and your occupation. So therefore, empathy is important. So it involves with many things. If you look at a person, the core of the person, the center, what is most important is the wisdom. And that governs everything. Now, in the component of wisdom, you get this your mindfulness, self-actualization, and compassion. And that will change your attitudes. That's what will build your attitude towards yourself as well as attitude towards outside world. And because of those two things, you develop competencies. Your competencies can be interpersonal competencies like communication, collaboration, advocacy, and various things, and your empathy. And then the other competencies and competencies of learning. And then all that will create the person that you are. What you do will depend on all your attitudes and competencies, your social responsibility, your occupation, and your specific tasks. Sorry for spelling, there are a lot of errors. Right. Now, the basis of this 21st century skills is to somewhat like that. You have a set of subject-based learning things, like what you have in your medicine, your anatomy, physiology, biochemistry, and stuff like that. But then that is not good enough. You need to have competencies, communication, collaboration, creativity, stuff like that. And then more than the competencies, your character is important. Your curiosity that will induce learning, your initiativeness, persistence, adaptability, leadership, and so on. So why I'm showing this is from education, but then the medical education is no different. So we have looked at the same thing and we have added, now we have the subject-based learning process and your competencies and your character qualities, but then beyond that, I believe that there's wisdom, and that has a bearing on the rest of the entire thing. So this is something that we have created. Competencies, your critical thinking, creativity, communication, collaboration, compassion, and connectivity. These are the things that we can teach. But then you can influence your character, but then you can't teach it totally. And the wisdom, again, you can't teach. Somebody has to learn. It's the responsibility of you to learn it and become that person, become that communicator, become that doctor. It's a different angle now. You see, now we would like to prevent all these bad behaviors, antisocial behaviors like homicide, suicide, child or woman abuse, rape, adultery, bad things like ragging, harassing your colleagues, robbery, corruption, bribery, sort of. That is a bad lot. You can see in the same black box I have put ragging as well. Okay, you have to prevent that. That's good. We should prevent, but that is not good enough. We should be able to prevent this disruptive behavior, non-collaborative behavior, creating conflicts and chaos. That's not good. We should prevent that as well. At the end, you will have a society, non-destructive, no conflict, no interactions, and peaceful life. My question is, as educationists, are you happy with that? That's not good enough. So you need to create students, a society, people who are empathetic, who are supportive, who are collaborative. Just you yourself being empathetic, supportive, collaborative is not enough. you should be able to promote that in the society, because we as human being, we can't live alone. So just because you are practicing good things, that's not good enough. You should influence the society. You can't live alone. You should influence society for them also to build those good things like empathy, collaboration, and harmony. And then you should create champions of and advocates of empathy, peace, and harmony and collaboration. So that's where you should target that as teachers. It's not just as learners, teachers. It's not just prevention of killing or bad things. Well, to do that, we recommend that you should avoid childhood adverse experiences, and then go beyond that. You need to teach coping strategies. That also not good enough. You need to build their capacity to deal with, but then finally, ultimate thing would be teaching empathy. If you look at the process of diseases, many processes of diseases, you focus on this side, start from infancy. Their dietary habit, stress, and feeding and unhealthy meals in preschool, your diet, lifestyle, and exercise in rest of the life, and smoking, bad behaviors end up in early deaths, atherosclerosis, cancer, diabetes, and death. So that's that aspect we are discussing about it again and again. But look at the other side. Now, poor parental care, anxiety, stressors, lack of respect to our children, restrictions, forced to do things, harassments, criticism, ragging, abuse, all that can lead to social disruption, homicide, suicide, and abuse and antisocial behavior. So your prevention, from this side, you start from early infancy. The other side also, you should start in early infancy. So empathy has a role in that side of prevention as well. Now, when you have to prevent illnesses, if I am to define these antisocial behaviors as illnesses now, I have already done that. Antisocial behavior is a part of illness. Can you do it by just doing punishment, giving punishment? You kill them, you hang them, that's going to work. And your checking and monitoring may not work. They does work, but then is that the only way to do it? And giving guidance, but what about appreciating good things? What about teaching empathy? What about engaging in conversation, engaging in play activities in infancy? So child rearing practices. So I believe this is a form of tertiary prevention, punishment and monitoring. If the antisocial behavior is an illness, this is tertiary prevention. And these are more like secondary prevention. These are primary prevention, where you appreciate good behaviors, you try to promote that good behaviors. And then going from there, this is what is called primordial prevention. I'm sure you all must be knowing about this. Now we are talking beyond primary prevention, primordial prevention, where you have a person's behavior changes, not a matter of not smoking, but also is not inclined to do things. And not only that, he is a champion of prevention, smoking, prevention of alcohol, prevention of abuse. And so you see, it's not just one person, but also he has a changed person. So that is the primordial prevention. So it's again given here, you have primary, the tertiary prevention, that's rehabilitation. Secondary prevention is you try to minimize the complications. Primary prevention is really you try to prevent your disease, like stop smoking, stop alcohol, avoid infections, your hand washing and all that. They are primary prevention. But the primordial prevention is creating a person without any rules and regulation, he behaved that way. So empathy can help you to create that primordial prevention, person with the primordial prevention. So primordial prevention start in child rearing practices, early childhood education, and primary education. So therefore, preschool education has a lot to do with this developing empathy and developing collaboration and working on that. Just some detail about this early childhood adverse experiences. The empathy is the antidote, teaching empathy. Childhood adverse experiences has impact on the brain change. Your frontal cortex get atrophied, and then there's decaying gray matter in the frontal lobe, and then atrophy of the prefrontal gyri, and then percunate gyri, which is a bad place which get enhanced. And there are hormonal changes that end up in diabetes, autoimmune disease, obesity, depression, and allergies. The immune system too does the same thing. There are changes, and then the neuronal changes are there, and then you have the genetic changes as well. What are the neuronal changes? The neuronal changes, the blood flow will go to the places where the places of managing stress rather than intellectual capacity. How can you prevent that? As teachers, as learners, we should understand this Maslow's hierarchy of needs. People have all sorts of needs. If these needs are not fulfilled, that will lead to stress. So stress is not a good thing. I'm not going to deal with this slide too long, but we as teachers, as students, yourself, you should look after your physiological needs, as food, shelter, things like that, your safety, and love and belonging. Be friendly with your friend, with your colleagues, and help them and respect them, and that's all important. In fact, when you talk about empathy, it's somewhere here, you can't stop talking about sympathy. And then you pity. And nobody is expected to be pitied. That is not good, that's bad. And you are dominating, you are sort of enjoying somebody's suffering by pitying somebody. That's not good. Sympathy too is not that good because there's no cognitive component in it. It's more of an emotional reaction. But empathy is emotional as well as cognitive. But why compassion is above it? Now, this is not from this is some international literature somewhere. Compassion is a concept where you become that empathetic person. I think empathy is trainable. Compassion is achievable. You have to sort of become an empathetic person, and that's the person who is compassionate person. Empathy can be trained. So empathy is defined as understanding, being aware of, being sensitive to, and vicariously experiencing the feeling, thoughts and experience of another, and caring and valuing them. So that's important. In other words, empathy is a way of connecting with other people to show that you understand what you are experiencing, and expressing that I understand how feel you, and I'm letting you know that you are not alone. So you can see that there are 4 components. You should recognize it, you should feel it, you should communicate about it, and you should act. So there are 4 components. Now, understanding empathy, I think one of the easiest ways is to compare that with sympathy, because people know about it. Empathy is a non-spontaneous thing, whereas sympathy is a spontaneous thing, it's a reaction. Empathy is intellectual, it's an advanced, effortful appraisal, understanding of, and altruistic cognitive behavior. Whereas sympathy is emotional, it's primitive, it's effortless, it's arousal. It's more of a feeling rather than understanding. And it's an egoistic, it's selfish, it's thinking about yourself. And it's an affective behavior. It's not an intellectual behavior, it's a more affective behavior. Empathy creates separateness, sympathy creates closeness. Now, this is an important statement. Those who are empathetic do understand this person who is suffering is not the same as me. That is why it does not cause vicarious trauma. It doesn't cause attachment. Whereas sympathy creates closeness. You are suffering. And empathy is a learned behavior. It's coming from the neocortex, which is the advanced part of the brain, and it's parasympathetic, it's inhibitory, and therefore it is energy saving. And it leads to professional satisfaction, and therefore burnout is less likely. Whereas sympathy creates closeness, there's attachment, you feel worried and you are suffering. And it's an innate and genetical behavior. It involves a limbic system, and it's a sympathetic, excitatory, and it's energy consuming. It causes vicarious trauma, and burnout is less likely. Now, that is coming from this Muhammad Raza Hojat's book, and it's a big book, and I recommend for you to purchase it for the university. I know that you have a very good library, and in fact, when I visited you, I suggested this. Okay, now looking at empathy, with new knowledge, or rather new knowledge one is new to me, and I have been reading about empathy these days. And beyond these four empathy competencies, like emotional literacy, that is you understand it, and perspective taking you feel it effective, and then you work on it, action, and then you communicate, interpersonal. So these are empathetic competencies, but now they describe as it goes beyond that. Empathy needs self-regulation. That's an empathetic competency. Empathy needs collaboration. You can't work alone. You will be a collaborator. You are asking for help and you are contributing and all that. And empathy needs a moral identity. You will understand in my next few slides. And then you have moral imagination, you have moral courage, and you should become a change maker based on your empathy. So that's how empathy can contribute to change the world for a better position, better understanding, improvement, and a change. So that is very important. Now, when I say emotional literacy, that means it's an understanding. I must thank Tanuja. I think Vishnu know Tanuja, Dr. Tanuja. I mean, brilliant pictures. Yes, given the real sort of feeling to that picture. That's really good. So emotional literacy is that understanding emotion. Now you can see this girl understand the emotion of this child. Those who can understand emotions become more popular, outgoing, sensitive, better adjusted, resilient, and they can achieve higher academic performance. Perspective taking is where a cognitive understanding and feeling of another person. When a student is upset, it is your duty to reflect on his or her feeling to the rationale for behavior before trying to correct the behavior. Now, I was sort of preparing this slide for teachers. That's why I'm talking about the teachers. And then that's not good enough. You need to communicate. You can tell that, you should tell that you understand it and you are there to help you. And then practice kindness. Just talking alone is not enough. You need to do that. You should practice. You should sort of help that person. And that is important. And then self-regulation is where with empathy, you get motivated, you feel like doing things, and you might get agitated, you might get angry, and you might sort of, may not be, calm and quiet when you see some certain things. Probably you need to stop getting upset. You need to sort of be calm, quiet, think about yourself. Probably you get advice from your seniors, parents, and that might help. So self-regulation is a component. But then in empathy, you need to collaborate. You are not trying to help others alone, and you will sit and discuss with your friends, and you will be working on it. So that collaboration part is very important component of empathy. And then we should promote our students to recognize their empathetic behaviors. This is very important for teachers, and not only that, students. And you should recognize yourself. When you are kind to somebody, you recognize yourself as a kind person. Now, when you want to change something for the better future, you feel that, oh, I have done this. What a great thing that I have done, and what is the achievement I have done. And you should feel that your achievement is you helping others. So moral identity is important. And then you need to have courage to do things. Moral courage is the inner strength that motivates child to act on their empathetic urges, help others despite the potential consequences. So that's something that is important for us to encourage our students and tell them, be courageous, do it. Then moral imagination is another important thing, where you think outside the box. You think of creating a world that is both ethical and successful for the benefit of everybody. You dream of that. And I think it's very important for us to support, encourage, and then facilitate students to develop that moral imagination and ask them, what I want to be when you are a big boy, or when you are old, and when you sort of, what is the job that you like to do? How are you going to help your parents when you are big? And things like that. That's moral imagination. And then I know that students with their empathetic engagement, they feel that we must do change. We must not sort of let it like this and things like that. So that is change makers, and change makers are important. Now this concept is very much used in UK prevention of ragging. There are this program called SEAL, where you develop empathy. In the process of developing empathy, you infuse them with moral imagination, moral courage, and the growing changes. You become changes, and they canvas for it. They will work for prevention of ragging. So those are the empathetic competencies, 10 empathetic competencies. Now, having said that, now you must think of, okay, these are all we have, and is there anything to change, anything to learn? So that's a good question, because I know many of you all have experienced that these are in you and within you, and you know it, and you are already practicing these important competencies. But is there a need to teach? Yes, especially when you are healthcare professional, you can enhance your empathetic competencies to a greater level, and that helps. That helps you to be a better doctor, better healthcare professional. So therefore, enhancing your empathetic competencies is a vital thing. That's very important, and always you must try to improve it. And it's not only the teachers, but also students should have a sort of desire to change, desire to become an empathetic person. How can you do that? You need to reflect about yourself, follow things, and there are many other ways of doing it. However, I must remind you all that this is what Socrates says, and this is what I say. I cannot teach anybody anything. I can only make them think. So that's very important. I'm sure Vishnu remember I used to say this when I don't know certain information also, but that's not what we are saying here. You can't teach empathy. Only you can make them think about their behaviors, feel about their behaviors as well as others' behaviors, understand their behaviors as well as others' behavior, and get engaged in their thinking and feeling process, and let them experience and reflect. And that is the process of learning empathy. Mohammad Rasa Hojad in USA, in Jefferson College of Medical Faculty, somebody whom I had a chance to go and meet and talk with him in USA. And in his big book, these are the things that he described. Methods of teaching, improving interpersonal skills, and you improve your communication skill with that. Along with that, you get empathy building, analysis of audio video tapes, taped encounters, being exposed to role model, role playing, and you act as patients and you role play, or patients or anything else, shadowing a patient, admit the patient and go along with the patient, look into all the aspects of that patient's need, maybe probably in the first year students, experience hospitalization. In fact, what they do is there's a bogus complaint and go and get admit and spend a day in the hospital, and then come back and report to your colleagues your experience. Studying literature, improving narrative skills, watching theatrical performance, Belin method. Belin method is where you share all your experiences. So there are various methods of teaching Hojad has described. In fact, this new, or rather, I mean, the teaching that we are planning for school principals, I think it's valid for our medical profession as well. How to learn empathy by health professionals. Sorry, the topic is now changed. And I recommend 5 methods. One is you need to role model, modeling empathy. Second, you can lecture about empathy. You can teach empathy by didactic lectures. And then you can talk empathy, where you get the students as groups to sit around and then tell stories. And then history taking with patients, from patients. And you share experiences. That is Belin method. But then practice empathy is where, as doctors, you do patient care, community projects, and simulated experiences. Now that's very important. practicing medical patient care is something that we do is routinely, but it has become a routine, and the emotional component of it, affective component of it has weaned off and it become mechanical. So you need to go back and reflect again, talk about it, and then you can improve it. And then induce global empathy is where you start thinking, feeling, and perceive beyond your vicinity. Now, say we tend to about our own people, the people whom you can feel, you can talk, you can see. That's our territory. The real empathy should go beyond that territory to the entire world. That is called global empathy, and it's not just the world; it's the sort of beyond your vicinity. Yes, one of the methods of inducing empathy is to discuss things like these famines, war, and pandemics, and how they have devastated the world. Just get them to uh, sit and think about these things and just imagine about these facts and figures, how much devastation has taken place, and what do you feel, and how can you sort of support, and what can you do for that. And then as teachers, now this is how I advise for teachers, but now I know that there are sort of, our audience is students, but you need to understand that. Just imagine your teacher is asking this question after showing that picture, what emotion did you notice? Now we are testing emotional literacy, whether you can see that feelings. What do you feel now? Your perspective taking. What are you going to do? You're practicing kindness. And what are you going to tell? That's a communication. And what consequences you anticipate if you try to help this group of people? Your self-regulation. And how are you going to get support from others? That is empathetic collaboration. Having accomplished the mission, name yourself. How are you going to label yourself? Say you go to India and you help those people and support, and then you see the new Mahatma Gandhi. So that's your moral identity. And what if you have the authority? So how do you imagine, if I'm the president of this country, this is what I will do. If I become the health minister, this is what I will do. So that's your moral imagination. And what if more difficult situation, say you might face with a lot of barriers and a lot of things that your people will not allow you to do that. So probably you are sort of, it's moral courage. And then you want to, how are you going to prevent such things happening? That's about change makers. So in our communication skill teaching programs, and where we sit around and then let people discuss, and probably they ask questions and they sort of discuss this, and probably the teacher might sort of sit and try to facilitate this process by asking that type of questions. And the other most important thing is to give him feedback in the most significant role of a teacher. Now you need to listen with respect, engage in conversation, and you must try to understand, reflect, and promote reflective learning. And you need to explore perceptions of students and then share their experiences. And then you need to plan more learning. But then not too much advocacy. Now we teachers have sort of got into the habit of telling a lot of things, a lot of advocacies, and never judge or criticize. So effective feedback should have this good quality of patient-centered approach and respect towards the patients. Now, when I was talking about this, I feel that feedback has two things. I have already mentioned about this intrinsic motivation and extrinsic motivation. I mentioned extrinsic motivation in my previous slide. Say, for example, severe punishment and warning and all that are extrinsic motivation, whereas your empathy building, your meditation and reflective learning are intrinsic motivation. So your intrinsic motivation can be positive, neutral or negative. Your extrinsic motivation also can be positive, neutral or negative. Easy to understand. What is the intrinsic motivation? Negative intrinsic motivation, where you regret and there's apprehension within yourself. Extrinsic motivation from outside, your punishment and your criticism, you imprison people, kill them, assault them, punish them, that's it. Whereas positive is where intrinsic motivation, you reflect on achievements, and then extrinsic motivation is rewarding. Now, intrinsic motivation is much more better than rewarding and praising. Not that they are not effective, but then you should be able to, as teachers, reflect on your achievement. As students, you should be able to reflect on your achievement. What is neutral intrinsic motivation? It's a realistic self-evaluation. That's the area where it says that there is more effective learning even beyond this, because it's neutral. You are intelligently interpreting. It's not emotional interpretations, and you get engaged in a conversation. If the teacher and student both are neutral, and then you get engaged in this educational conversation, that's where your learning happens. So teaching is an extrinsic motivation, it's not intrinsic motivation, whereas learning is an intrinsic motivation. So therefore, my advice to students is try to get engaged in learning process, which is intrinsic motivation. That will help, that will change, that will not create stress, and you will feel good, you will feel happy about what you are doing. So global empathy is where you want to think, feel, and perceive and act beyond your vicinity. So that's about sort of you're thinking of entire community, and then you go beyond your sort of people who are coming to you, but then you think of prevention, you think of change in the world, you think of we should get engaged in not just treating patients, but also in managing healthcare system. And probably it's my global empathy. Now I am involved in more of education. I believe that education is more important thing than just treating patients. Thank you. So that's it. And Vishnu, do I take questions? If you have questions, I'm happy to answer. And I hope it is helpful. I invite you all to sort of get engaged in empathetic teaching, use empathy in teaching, teach empathy, behave empathy, and then do research on empathy and promote empathy. Thank you.
Thank you very much, sir. It's a wonderful talk about the empathy in a medical professional, and I'm sure it's an eye-opener for most of us, and it will increase our improvement of our clinical practice. And there's a question, sir, from the audience.
Yeah.
So I'll read it for you.
Sure.
Can emotional literacy could be inculcated in community or community level, and how it is possible?
Yes, yes. I mean, that's a good question. Yes, that's the question. Now, all those empathetic competencies can be inculcated. Now, empathetic competencies can be inculcated by practice. Now, Vishnu, you know that we are teaching communication skills. In the process of teaching communication skills, we do inculcate empathy. Now, there are good research. Now, Jefferson's scale of empathy is the one that can measure your empathy. And after engaging in a communication skill training program, they become more empathetic. And then those 10 methods of teaching empathy, Hojat says that there's improvement. So there's definite thing that is happening. Now, all those methods of teaching empathy include emotional literacy. See, now people are different in the world. Some people have bigger, higher capacity of understanding and seeing and recognizing the emotions, but others do not have. Now, that is what is happening in our your schizophrenia. So you have your what you call this autism and all that conditions where you have a problem of recognizing. They don't recognize empathy, emotions. So you don't understand the pain, you don't understand suffering, and you don't sort of really perceive the fact that somebody is crying. You will be just laughing. So, but then that can be taught, that can be improved. Thank you. Anything else?
No other questions, sir.
Okay. Thank you very much then.
Yeah, thank you very much, sir, for accepting our invitation to be a keynote speaker at our session.